From her early days on the Disney Channel to her current status as a pop sensation, Sabrina Carpenter has captivated us with her incredible talent and stunning looks. But many wonder, has she undergone cosmetic procedures to enhance her appearance? All estimated costs and a before and after are revealed later on, so stay tuned. In her teenage years, what we see here are high, full brows. She has nice infrabrow fullness and supratarsal show. When I look at her nose, I see a narrow nasal bridge. And her upper to lower lip ratio is about a 0.9 to 1. She does have upper tooth show on repose, meaning when she just parts her lips. And she has a strong upper and lower jaw, including a strong gonial angle, and that's the angle of the jaw right in here. What that does is that it increases the width of her lower face, and that can be caused by the actual thickness of the jaw itself, or sometimes by the muscle that overlies it called the masseter muscle. You may have heard that some people get Botox injections into that muscle to try to reduce its strength, whether that's for helping them with TMJ pain or potentially to reduce the width of the lower face. But that muscle or its underlying bone can add to the lower facial width. In 2017, at the age of 18, Sabrina has nice youthful cheek fullness, and that fullness is more medially based, meaning closer to the center of her face. And that really works in youth, but as we get older, some people try to recreate that with filler, and it can look somewhat artificial, especially as the face starts to sag and medialize and move down. That extra weight in the medial face with filler can at times look a bit unnatural, but in a youthful state, it is very natural appearing. And I wanted to point out here that the nasolabial folds are very much present, and this is how it actually looks in a more natural state. So when people try to again use filler to efface the nasolabial folds, things can start to look a bit more artificial because you're starting to blur those boundaries, those facial subunits between, for example, the perioral area and the cheek complex. In a natural state, those boundaries are more well defined with things like the nasolabial fold that serves as the boundary between those subunits. And I also wanted to point out here what I think is a distinctive characteristic of Sabrina's face, which is that the philtral columns are not well defined. So in some people, you have quite a bit of depth to the central area of the upper lip where the philtrum lives, and you have the philtral columns on either side. In Sabrina's case, the area of the upper lip is flatter and there's less of that indentation between the philtral columns. And that gives her quite a distinctive look. In 2018, at the age of 19, when I look at Sabrina's profile view, what I'm seeing here is that she has a more rounded type of forehead, and that can sometimes give the illusion of a larger forehead. But it's not that she has a large forehead. It's not that her upper third is much larger than the middle third or the lower third, but what gives it that illusion is how much roundedness there is to the forehead itself. And that might be one reason why she seems to use her hair to hide partially some of her forehead. Now, it might have nothing to do with that, or the roundedness might have something to do with her actual hairstyles. Keep in mind that the size of the forehead is not just its height centrally, but also the width of it laterally. So how far out it goes to the sides will also dictate if it looks like a larger forehead or not. Some people have quite a short forehead centrally, but as you go out laterally, there's quite a bit of width, let's say from the tail of the brow to the actual temporal hairline. And so sometimes when I'm doing hairline work and looking to help frame the face, it's not just bringing down the central hairline, but it's also bringing in the lateral hairline, because that can also shrink down the overall appearance of the forehead for people who are bothered by that. Also on profile view, what I'm seeing here is a small dorsal hump. So as you come down from the radix of the nose down towards the tip, you can see that there's this slight convexity to the nasal bridge, and that's that small little hump. In 2019, at the age of 20, Sabrina seems to be using makeup to highlight certain aspects of her face. For example, when you look at her cheekbones, there's a bit more definition there, and I think part of that is because of the shadowing that's placed underneath the actual cheekbone, and that gives the cheekbone a bit more of a pop. Also, I do think that she's starting to overline her upper lip, and that's starting to create more of a one-to-one upper to lower lip ratio. But I also see some signs here of the potential introduction of lip filler, both to the upper lip and to the lower lip, to add some hydration and a bit more volume. As we know with lip filler, it's important not to overdo it. You don't want the lip to start to stick out anteriorly to project forward, because that's what gives that ducky appearance. So avoiding the actual vermilion border when you inject is very important in trying to prevent that type of appearance. And I think that they've done a very nice job in Sabrina's case of not overfilling the actual vermilion border. In 2020, at the age of 21, I see no change. In 2021, at the age of 22, what really stands out to me here is how thick Sabrina's eyebrows are. It's quite in vogue again to have thicker eyebrows, and there are different ways in which people can achieve that look. Now, for some people, it comes down to just using more makeup. Other people might try some tattooing or some more permanent type of makeup, or even microblading. Yet others will sometimes go for eyebrow hair extensions that get glued on. And there's another method called an eyebrow hair transplant, which isn't as common, but it's something that I do in my practice, and we have dedicated videos on that subject, and that can really help enhance, especially after someone's done a lot of plucking or their eyebrows are just naturally thin. But I think in Sabrina's case, her eyebrows are naturally quite full, and she's sporting them, which I think they look great. Also, what I think we're seeing here is potentially the introduction of cheek filler. When I compare back to this image of her in 2017, what I'm seeing is that now there appears to be more laterally based volume in her cheeks, as opposed to her more original organic state, which is more medially based volume. So now there's this extension out laterally, which starts to bring more of that width to her upper face as opposed to just the lower face. Some people will actually get cheek implants to achieve a similar appearance, but I think in her case it was probably cheek filler that was added to the zygoma region of her cheek to fill out that lateral component. And before I continue, I just wanted to thank everyone who's tried our Feel Confident skincare and hair care products. We made them from scratch with love. We put amazing ingredients in them, and we tried to keep them affordable. So thank you guys for showing your support, and for some of you for even becoming brand ambassadors, which is really cool. And for anyone who hasn't tried the products yet, make sure to head to feelconfident.com to try them for yourself. In 2022, at the age of 23, I see no change. In 2023, at the age of 24, I'm seeing some signs of a potential tip rhinoplasty. So to me, Sabrina's bridge looks untouched. It has the same width as it did when she was in her teenage years, but now the tip appears to be more narrow. It's similar to the width of her bridge, whereas before the tip was wider. And these results are less obvious than when the hump is also taken down. So many celebrities will actually leave some convexity to their nasal bridge with that hump, and instead just get their tip more refined. That's harder to spot than when the whole nose is redone. And when we compare back to Sabrina at age 16, we really start to see that difference to the nasal tip, whereas the nasal bridge looks quite similar. And in 2024, at the age of 25, when I look at Sabrina's lips, to me, the upper lip looks more arched. And I think that's probably from the continued use of filler. I don't think she's had a lip lift. So with the overlining and the additional filler, that's given her upper lip quite a nice upper arch. And that's something that is sometimes difficult to achieve naturally with filler, but I think her lips still look great. So this was likely done with small, tasteful amounts of filler over years to create this appearance. This is not something that you just go in, get 1 syringe of filler or 2 syringes of filler at one time and call it a day. This is something that's done gradually with a very calculated approach, and I think that she still looks youthful and natural and does not look like she has overdone lips. And the total cost of these potential cosmetic procedures is $40,000. Do you agree with this analysis, or do you think that Sabrina is all natural? Comment with your thoughts below, and let me know which celebrity I should cover next.